Vishakha, what are the key problems that you're seeing in your practice when it comes to nutrition?
I see lots and lots of metabolic diseases that come to me. So whether it is obesity, whether it is polycystic ovaries, whether it is dyslipidemias, fatty liver, type 2 diabetes, all of them. So I've been seeing this for a long time, but the sad thing is now we're seeing it in much younger age groups. So we're seeing kids who come with it. And that really tells you what the future is going to be. So I think that needs to be addressed, and that's really sad. Or the other thing I'm seeing post-COVID is that the cases of autoimmune conditions, especially gut-related autoimmune conditions, whether it's irritable bowel syndrome or, their manifestations, whether it is psoriasis, rheumatoid arthritis, they have hugely surged post-COVID.
Well, Dr. Vishakha, what about diets and NCDs, non-communicable diseases, say such as obesity, as well as blood pressure, hypertension, diabetes? Can it all be reversed with a good diet?
Well, first of all, I think it's important to know that we don't have a universal answer to this, because your parameters will be completely different from mine, will be different from hers. So to universally say that something can be eliminated completely using one part of lifestyle is not necessarily correct. So there is no blanket rule to begin with. Can it hugely benefit? The answer is yes, because there are certain universal principles that apply across the board. But we have to understand there's a lot of differential also. Your gut microbiome is different from mine. Your genetic pool is different from mine. Your likes and preferences are different from mine. So we have to take all of that into account. Only then can your gut microbiome is definitely different from mine. And so we have to take all those into account before we can answer that question to say whether they can be eliminated or not. But like I said, there is a huge difference that can be made with lifestyle, especially with diet.
What is the ideal diet for diabetics?
First thing I would say, to go back to that, would be cut off processed food. And if you're a diabetic, I wouldn't say limit, I would say cut off processed food. Nothing that comes out of a tin, can, bottled, is processed, should be used. Place only in the trash can. Liquid sugars. So there is this myth that you can have liquid sugars, whether it is honey, maple syrup, agave. Our grandparents had it, our ancestors had it, and it's okay. The fact is, if you're diabetic, you already have a problem, and you cannot then use these sugars, whether they're natural or not. The same thing goes for fruit juice. I have, so many people who come and tell me, but it's natural, we've just squeezed the orange juice. No, but it's pure fructose. Glucose is metabolized by every single cell in your body. Fructose is metabolized essentially by your liver. So when you are drinking liquid sugar, you're going to cause that spike in blood sugar and spike in insulin, and there's no question then that you're going to worsen your condition. So if you're a diabetic, you don't have an option but to give up liquid sugars. The second thing I would say is, of course, like you began by saying, we are a country which is very low in protein. So you need to make sure you're having adequate protein, especially if you're a diabetic, and good bioavailable protein. So whether you're veg or non-veg, it's frankly quite easy to make sure you get enough protein. So that has to be calculated and given correctly. And don't fear your fats. In this country, everybody says, oh my God, you're eating butter, you're eating ghee, that's bad for you. No. Eliminate the pro-inflammatory fats, the omega-6 and 9 fat. Those will kill you. Those are the ones you need to be fearful from. These oils have to be eliminated. Use good fat. Use ghee. Use olive oil. You don't need to use avocado oil, which is prohibitively expensive. You can use mustard oil as one of the only seed oils that actually is good for you. So you can use that. But whether you're a diabetic or not, why is fat so important, especially if you're a diabetic? We have 3 food groups: carbohydrate, protein, fat. We've spoken about the carbs and said what we need to eliminate. Within the carbs, you must have the fibrous ones. So vegetables and fruits are great for you. Even if you're a diabetic, make sure you're having a low glycemic ones, the ones that are not full of sugar. So that you should have. Proteins, you must have, because you need your muscle mass, you need it for immunity, and will help every diabetic. Fat is hugely important, especially for a diabetic. Of all these 3 macros, nothing balances blood sugar as much as fats do. So if you're going to go on a low-fat diet, like people say, but we have low-fat yogurt and we have, low-fat milk, I tell everybody, please stop, have full-fat everything. Just make sure the fat is a good quality fat. Your brain functions on fat, so your cognition will decline. And nothing satiates you more than fats do. So if you're a diabetic, and if I'm going to tell a diabetic, no, you can't eat certain carbs, what are you going to eat? So you eat protein and you eat your good fat. And not only will your blood sugar stabilize, you'll feel good, and you know, the parameters change so fast. We see this at the clinic all the time.
Okay, all right. So fats are good for you. That's the word coming in. Well, Dr. Shivdasani, you know, I wanted to get your thoughts on migraines and diet. What's the connection, and do you think migraines can be controlled with a diet?
To a huge extent, absolutely. So water plays a big role. Hydration is key, and most of us are, you know, we don't drink enough water, especially when we're sitting in air-conditioned
And how much
rooms.
water should we drink, actually? Should it be 8 glasses?
No, I always tell my patients, look at the color of your urine. And that will be your best indicator. See, someone might have a kidney disease, someone might have, you know, other issues, you might be working out more than me. So just to say that 8 glasses, 9 glasses, it's not a universal answer. Look at the color of your urine. If the color of your urine is pale white, closer to whitish color, that means you're well hydrated.
Okay.
But if it's very concentrated, deep yellow, that means you're dehydrated.
Okay, now getting back to migraines.
Yeah. Okay, so you need to have enough water, hydrate well. You need to make sure you've got enough iron. A lot of women with iron deficiency get migraines. Now remember, iron is not the same as hemoglobin. You can have a normal hemoglobin report, but you can still be very low in iron, so that's important to test. And then of course we give them foods that are rich in iron. Sometimes we need to supplement with medication also for that, but that is probably the commonest cause, as is magnesium deficiency. So we test it, and if you're low in magnesium, then we prescribe a lot of green leafy vegetables, which are high in magnesium, especially because they're chelated and they get chlorophyll. So they're really high in magnesium. So you include that. I like the use of omega-3 because it's usually anti-inflammatory, so that helps. So whether you're doing it through a supplement or diet where you're going to eat lots of nuts and seeds and you know, fatty fish, that really helps with migraines also.
Okay. What is the advantage of IF?
You name me the organ of the body and there is an advantage to IF. I mean, there is, whether it's to...
And this is for NCDs as well?
If you're looking at, see, I'll tell you, any NCD which is a hormonal NCD, you have to do intermittent fasting under guidance. Else it will backfire, and that's what gives IF a bad name. But it's not the fasting. Fasting of any sort, whether it's intermittent, whether it's time restricted, that the study talks about, whether it's a 5-2, there are 20 different kinds of fasting. Whatever fasting you do, the reason fasting gets a bad name because it's done badly. So when you talk about NCDs, when you talk about diabetes, thyroid, these kind of things, if you're not going to do it under guidance, of course it's going to backfire. But why are you blaming the diet? You blame the way you're doing it because you're doing it incorrectly.
Okay.
But if you talk about brain health, you talk about gut health, you talk about not weight loss but fat loss, you talk about cholesterols, you talk about sugar control, there is nothing that IF doesn't help with.
Superfoods, do they exist or is it just a marketing gimmick?
If 80% of your diet is clean, then the addition of superfoods will hugely help. But if your diet is crap, throw the superfoods. It's not going to make any difference to you.
Okay, and which is the best superfood?
I like mushrooms because it really helps cognition, helps as a prebiotic. Black coffee is great if you stick with 1 cup. So turmeric, black pepper is also great.
Okay, all right. Dr. Vishakha, how many fruits should we consume in a day?
You can do 2 or 3 if you don't have a metabolic problem, but if you've got any of the sugars, insulin resistance, etc., then stick with 0 to 1.
Foods high in vitamin D3 as well as B12.
Virtually no foods are high in D3 except some small quantity maybe in some fatty fish and egg yolk. You need to get it through sunlight or a supplement. B12, all your protein sources are high in B12, especially the non-vegetarian proteins. And the vegetarian proteins are nuts and seeds and mushrooms.
Okay, well, Dr. Vishakha, how important is proteins for women, and should it be consumed only if you're working out?
Absolutely not. A woman requires protein. After 40, we lose 3 to 5% of muscle mass and we get sarcopenia per decade. So whether you lift weights or not, it's your currency to longevity. So you need to include lots of protein, irrespective of workout.
Sources of proteins for vegetarians?
Oh, lots of them. Nuts, seeds, paneer, tofu, lentils, sprouts especially. So lots of, sources, all forms of soya also.